does the 12th edition of Anantnarayan Panikar's textbook of microbiology have to offer? We have with us the editors of the book to answer this and several other questions. They really do not need any introduction formally, but it is my privilege and pleasure to do so. Dr. Reba Kanungo is adjunct professor at KMC Mangalore and former Dean of Research and professor in HOD at Pondicherry Institute of Medical Sciences. Dr. Sonal Saxena is currently Director Professor and Head of Department at Maulana Azad Medical College, New Delhi. Before I hand over, I encourage the attendees to post any questions they may have regarding any of what they're hearing or any doubts that they may have in the question and answer box, and we will endeavor to answer these questions at the end or during the presentation. Without any further ado, I invite Dr. Reba to take this discussion forward. Ma'am, over to you.
Thank you, Dr. Sudha, for that introduction and for taking the initiative to launch the book to the faculty and students in the country. To begin with, I would just like to give you a little background. When we brought out the 11th edition, we were, that was the time when CBME was just being introduced. So everybody was completely at a loss as to how to go about. So we went forward and brought out the book, but made very, very minimal changes, especially in the syndromic approach. However, during the last 1 year, we have been able to, the publishers have been able to gather the information from the various faculty across the country and some of the students. And based on the questionnaire, we have tried to make the necessary changes, which are very important for the CBME. Now, I would just like to share my slides. One second. Okay, so to begin with, as I mentioned, the publishers went all out to reach out to the faculty, and based on a questionnaire, we tried to align the topics based on the competency-based teaching learning of the National Medical Council. Now, so there were the questions that arose in everybody's mind was, there were a reduced number of teaching hours, only 80 hours available, in contrast to the number of to the 1.5 years course that we had, and what contents had to be cut down and why. The value of the introductory chapters, what is covered and why. Infection control and antibiotic resistance was another important aspect which had to be given stress on, and how the importance of organisms have been decided upon to be addressed based on the syndrome. So there were huge questions. So a lot of thought went into, a lot of sit downs and discussions before we made a format and went ahead to publish, aligning these chapters and rewriting almost the whole book. So the chapter reorganization was completely in compliance with the CBME guidelines. And as you can see, the CBME guidelines had put out the various components, the various chapters, where it should go and how. And the book has gone all out to adhere to these. Now, the Anantnarayan and Panikar 12th edition begins with a note to teachers and students on how to make the best use of the book. So we have actually made the general microbiology as a first section in the book. Now, this general microbiology consists of all the overview chapters, a brief introduction, and followed by that, there is we have incorporated antibiotic resistance, sterilization, disinfections, healthcare infections into the first or the general, which are basically chapters which overarch all the other systems. Then the second section is the immunology, which deals, basically is adhered to the principles of immunology, which was there, which is required for the microbiology students. And then the final section is the syndromic approach, where we have made the drastic changes and incorporated the whole of the CBME pattern into this particular section of the book. Now, going a little to the contents as to what do they cover and why. So as you can see, the basic concepts in microbiology has been addressed first. The basic concepts are the foundations, and in that we have discussed the sections as per bacteriology, virology, mycology, and parasitology in this form. And here what is discussed is just the general concept and very, very basic information, like the classification, general properties, and some of the virulence factors, which are again overarching for these organisms. And then next we have gone on to briefly to the microbial genetics and epidemiology of infectious diseases. Now, why you might ask us, why have we combined, or not rather combined, why have we put this in a sequence? Now, as we know, as science progresses, many of these epidemiological factors are based on tracing of organisms, and wherein the sequencing and the microbial genetics come in. So therefore, they need to have just a very basic information on genetics, and then move on to the epidemiology of infectious diseases. After that, we have taken these three subjects together, these three topics, that is sterilization, disinfection, antimicrobial agents, and infection control in healthcare settings. Now, as all of you must realize, or you must know, that these three are very intimately linked in terms of infectious diseases, where the sterilization, disinfection comes in, then the antimicrobial agents for management, and how do we control these infections. So all these chapters have been addressed in the general microbiology portion. After that, we have dealt with the next portion is dedicated to immunology, which has followed the general pattern, but we have definitely made some changes with regards to concept approach of immunology with diagrammatic representations. And then finally, we have microbiology as applied to infectious diseases, where the syndromes have come in, and we'll discuss a little more in detail about the syndromic approach and how have we addressed this and how have we aligned it. And in this table of contents also, you will find the competencies as mentioned in the CBME. Now, the next question that comes to us is, there are so many organisms, bacteria, virus, parasites, etc. So the student is, we've already got the feedback that the students are thoroughly confused as to they have to jump from chapter to chapter, skip, go backwards, forwards. So in order to help them out, there is a portion where the chapter locations have been mentioned. And as you can see, the first part is the overview chapter. Chapter 3 is the overview of bacteriology. And then under that, each of the bacteria have been addressed in terms of diseases, like respiratory infections, skin and soft tissue infections. Same with viral infections, where we have herpes virus, which is the general overview is there in chapter 4. And then followed by that, the infections in genitourinary infections or skin and soft tissue infections. Now then, going a little deeper into the overview chapter, we have dealt with these organisms as per gram-positives, gram-negatives, and the general description of gram-positive bacteria, gram-negative bacteria. Now, bacteriology has been divided into two. One is the structure and classifications, and next are the systematic classification approach to bacteria. Now, in the general concept, you have the general structure of bacteria, their antigenic structures, and etc., their classifications. And coming to the systematic bacteriology, we've addressed the gram negatives, gram positives. And in that, what have we addressed is the, let's say, take example for Salmonella. Now here we mentioned Salmonella in the overview chapter, and that comes into chapters 20 and 24, that is bloodstream infection and the gastrointestinal infections. Now in that, after describing the bacteria as such, there is a little box which tells you what are the infections where these organisms can be associated with, like typhoidal, non-typhoidal. It's the same way with the Klebsiella and the actinomycetes. So for each of these bacteria, there are little boxes which tells the student where these infections, where these organisms can be studied in detail and what infections they produce. Then the next thing that we have done is the diagrammatic representation of systemic infections in the overview chapter itself. So that when they are doing the overview, they are also at the same time imbibing the concept of where these organisms can be associated with, what infections they can be associated with. So like, for example, the fungal infections, subcutaneous infections, what are the fungi which cause subcutaneous in the overview chapter itself. And the sexually transmitted infections, what are the bacteria which can cause infection, or the parasites, how do they, the organisms, how do they enter the body? So these diagrammatic representations will help the student to have a visual impact of, and plus retain the listing. The other unique feature of this book is that the common etiological agents, let's say in the bloodstream infection, in each chapter we have these boxes which tells them which are the common organisms which are associated with these infections, both bacterial, viral, fungal, and parasitic. So this way the student is, again, it is reinforced. Now the next concepts in antimicrobial mechanisms. In this chapter, we have dealt with all the antimicrobial agents, not just antibiotics. And there are clean diagrammatic representations of the mechanisms of actions, mechanisms of resistance, then the antifungal agents, where do they act and how do they act, going into the descriptive approach with the diagram for easy understanding. And also for the antiviral agents, which have, we've divided the mechanisms of actions of these antiviral agents. How do they act? So again, this is in the overview chapter, in the general microbiology chapter. So when they go into the syndromic approach, they are already aware of the antimicrobial agents and the mechanism. So it becomes easy for them to relate to the infections when we teach them the infectious agents. Then here we have also included the infection control, hospital-acquired infections. And we have updated this chapter with the care bundle approach and various other PPEs and the recent concept of the infection control practices, surveillance, outbreak follow-up. And then we've also added a little bit a chapter on laboratory acquired infections. Since they are microbiology students, they should also be aware that laboratories in the hospitals could also be a source of infection. So, sorry. And then we have gone on to the immunology part. So here we have, we've gone by the previous edition, but we've added a little few, like post-transplantation infection, methods of detection of complement or complement estimation in diseases. And also there is another part which we have added is the action of that in immunoprophylaxis chapter. We've also added diagrammatic representations of the DNA virus and DNA vaccines and RNA vaccines, which are newer concepts, which the undergraduate student needs to know because of this recent advent of COVID. A lot of discussion went on as to the mRNA vaccines. So how do these mRNA vaccines act? And so the book also has a little diagrammatic representation for easier understanding of the action of these vaccines. Then the other questions which came up from these questionnaire from the faculty was, how has the syndromic approach been accommodated? What is the standardization that has been adopted in the presentation of the syndromes? and the organisms? Why has pathogenesis been presented in flowcharts? What is the importance of diagnostic algorithms? And why are case studies placed within the chapters? So to answer a few of these questions, what is the basis of organism allocation in the book? Now, this is based on the competency mapping. The competencies have been assigned as appropriate to the content covered in a chapter. There may be several related competencies in a single chapter. Now, for example, the NMC has put in the competencies bloodstream infection, followed by that gastrointestinal infection, etc. So what we have done is we have just changed it a little in relation to the making it easy for the student to understand. So what we have done is we have gone like an anatomical approach, in the sense we have discussed bloodstream, which is of course the first competency, cardiovascular and bloodstream infection. Followed by that, we have gone on to the respiratory tract, then onto the CNS, and then GIT. The reason why we've done this is basically that the organisms which are involved in these infections follow a route. Like, say, for example, bloodstream is a general infection across the body. Then the respiratory tract infection. So the bacteria or the organisms which are associated with respiratory can also produce CNS infections. So there is a link between the bacteria, the organisms associated with respiratory, followed by that as they progress towards the CNS infection. So that is the reason why we have followed that chapter. But then again, it is open to the faculty across to choose whichever chapter they feel. If they want to follow the CBME, the NMC guidelines, then they can teach them the cardiovascular chapter first, then go on to the the gastrointestinal chapter after that, and then so on. So whereas for the book has this kind of a flow. Now, going to the syndromic approach, how have we arranged this chapter? Now, as you can see, there is in the beginning of the chapter, there is a chapter navigation, which shows, what are the organisms what are the systems which are covered, and what are the organisms that are associated with infections in these. So we have, and then we have the learning objectives, which tells us what the student should learn in this chapter. Like, for example, at the end of the session, the student should be able to describe the etiological agents, the pathogenesis and diagnosis of rheumatic fever and infective endocarditis, discuss various causes for bloodstream infections, etc. So now, as you can see, we have got, aligned it in such a way. This first half is the cardiovascular infections, then we go on to the bloodstream. And in the bloodstream, we have classified them as bacterial causes of bloodstream infection, viral agents associated, and then we've talked about the vector-borne parasitic infections where malaria, etc. comes in. So this is how the whole chapter has been organized. And as you go through this chapter, you'll see that the organisms which have been listed here have been described in a little further detail as to their pathogenesis, their virulence factors, then how do we detect them, and what are the what are the antibiotics or treatment that can be given for these infections. So these things have been aligned after this. So the bloodstream infection is followed by Staphylococcus with coagulous positive, negative. Then the gram negatives, we discuss Salmonella, Yersinia, Leptospira in this chapter itself. Then in virology, we go on to dengue, chikungunya, etc. In parasitology, we go on to malaria, leishmaniasis. And in fungal infections, we go on to candida, because that's the common fungus which causes bloodstream infection. So that is how the organisms also have been aligned with this particular chapter. Now, next was the why is the pathogenesis of various organisms presented as flowcharts? This was another major question. Now, the importance of flowchart again makes it easy. It's a kind of a visual impact for the student to remember that, let's say, events leading to the formation of gas gangrene. So it's easy for them to understand that there is trauma followed by tissue damage, then the bacteria gains entry, then the spores germinate, and then the tissue necrosis, edema, etc. occurs, which leads to toxemia, myositis, and crepitus. The same way for tuberculosis and for diphtheria. So in each of these syndromes, these type of flow charts with regards to pathogenesis. Of course, there is a description. No, it's not just that the whole pathogenesis is contained only in the flow chart. There is a description, but again, as a take-home message, the tuberculosis or diphtheria, important infections have a flow chart in the form of pathogenesis. Then next we come to the diagnostic algorithms. Now, diagnosis actually is an overarching or almost similar for many of these infections. But what we have done is we have taken out the specifics. Like, for example, in bloodstream infection, what do? You collect the blood, then you culture in various methods. Then you could do a toxin assay, you could do serology. So the whole thing is put in the form of a flow chart or in an algorithm. This algorithm will be helpful for them to retain and to recapitulate, which includes the various newer methods also, which have been incorporated into this. So a bloodstream infection, then you have, in case of filariasis, how do you do? So for most of these common infections, we have the diagnostic algorithm. Now, next question was, how relevant is the case studies within the chapter? Now, it's very important to remember that when the student is doing a chapter, they need to imagine, or they need to incorporate a clinical aspect, since we are all moving towards a clinical approach to infectious diseases, to microbiology. So we have incorporated the clinical cases within each chapter. So each chapter has a specific, like diphtheria has a clinical case on diphtheria or meningitis, etc. So these cases are incorporated within the chapter to make it easy for the student to correlate. And also we have got little boxes of any important outcome of these clinical infections. Then coming to the treatment part of it, we haven't gone into the very great details of treating the whole infection as such, but the whole management of the case, but treatment is as to what is the specific anti-infective agent that is given. Like, for example, here we take a case of giardiasis. So the treatment says that, you could, the patient is treated with metronidazole, alternatively intranidazole or albendazole, and then also how can the cysts be removed. So these little, adjuncts to the treatment is also incorporated. And then the other thing that we have also done is, outcome of the, many chapters will have various outcomes. Many infections have various outcomes. So there also we have small flow chart to show what could be the outcome of, let's say, hepatitis B infection, which is a very common infection. And so what can happen? Occult hepatitis, adult infection, chronic infection. And so that is represented in the form of a flow chart. Now, the next question was, what have you done with COVID? Now, COVID has been, plaguing all of us. So what have you done? Now, at the undergraduate level, we decided how should we, because there is an overwhelming form of information, both in all kinds of, in all types of methods. So we have taken down the very salient features and made it really up to date. In fact, the Omicron mutant has also been included with the variants of concern. And then in the epidemiology chapter also, we have laid a little importance to the epidemic, pandemics, and endemic diseases. And so pandemic, how to, do the pandemics case tracing and control. And in coming back to COVID, we have also got this little diagram to show the undergraduate, to tell the undergraduate that how the virus replicates and what is the pathogenesis and transmission. This would help them to understand the mechanism of action of the virus and its outcome. So now the other thing that we have done is describe various techniques. The other question was the certifiable competencies. How have you addressed certifiable competencies? I mean, do you have a separate practical record? That again depends on each individual teaching organization to decide on what they want to do. But as far as the certifiable competencies are concerned, we have incorporated that with the basically there are very few competencies that are required for a microbiology undergraduate. So the Gram stain, we have gone into the details of the Gram stain with diagrammatic representation, the procedures, and then also the other competency is the standard precautions, especially the hand hygiene and PPEs. So those have been addressed in the book also. Now, the additional features in this book are the epidemiology of infectious diseases, the national programs applicable to infectious diseases, then miscellaneous infections. We've gone a little ahead to include ocular, ear, congenital infections as additional features. Now, the very important question which came up was, do you have a separate chapter on AdCom? Now, what we felt was the AdCom has to be incorporated into the laboratory processing and diagnosis. So what we have done is, in the initial chapter, we have got a little bit of a portion included as ethical issues involved in processing and reporting of test results, which is based on the doctor-patient relationship. And we've discussed about the several ethical principles which are applied to processing of samples, like and the person's autonomy and confidentiality, which is very important in terms of also the laboratory processing. So they need to relate to, the AdCom has to be related to the laboratory aspect of processing of patient clinical material. So that is why we have integrated this into in this chapter. However, the AdCom as such, as a annexure, is available online, and that can be downloaded if anybody wants to add on to this, because we didn't want to include it as a chapter in the book. We've kept it. There are several other aspects of Anantanarayan Panikar's annexures which are available, and which I would encourage all faculty and students to download and make use of it. So with this, I must end my presentation, and I hope Anantanarayan Panikar's 12th edition is going to meet the needs and challenges of the competency-based microbiology learning, which is a very, very important step forward in order to make the student, a doctor as a person of first contact when they go out to meet the patient. This book would help them to establish themselves as persons of first contact. To this, I would like to place on record but the faculty, my thanks and gratitude to the faculty members and students who sent in their suggestions, to my colleagues who have provided extremely valuable inputs throughout the writing up of the book, the publishing team at Universities Press for giving us the opportunity to edit this edition of Anantanarayan Panikar's textbook of microbiology to meet the requirements of the CBME's curriculum, and to everyone who has attended today's webinar. Thank you very much.
Dr. Saxena, ma'am, thank you so much, Dr. Reba, for your presentation. It was really gave a fantastic overview of what faculty can expect with the 12th edition. May I invite Dr. Saxena now to please upload her presentation and continue with the certain aspects of the book. Dr. Reba, can you stop sharing?
Yeah. I'm doing that. Sorry.
Thank you so much. Dr. Saxena, it's over to you, and we're all very eager to hear what you have to say.
Thank you so much. So is my screen visible, and am I audible? Good evening, everybody. Ma'am has covered beautifully the context of this book till now, how we've worked around on this book. And I'm going to talk about the portions that have been integrated by me. The parasitology content has never been a part of Anantanarayan Panikar's textbook of microbiology. And this is such a classic that it's an honor to be associated with this classic, another along with a stalwart like Dr. Reba. So I'm going to talk a little bit about what we've integrated in terms of parasitology content and how we've gone doing it. Because majority of the time, the students have this concept that they have to jump from pages to pages, and always parasitology was a section which was taught separately. Students would carry a different book of parasitology, and somehow it was always felt by the students that it is not a part of clinical microbiology, because even though they saw a lot of malaria, they could never put it inside clinical as an aspect of clinical microbiology, because they always felt that it's a separate topic, it's taught separately. And a lot of feedback that we collected also gave this idea from the students that they were not able to integrate parasitology into clinical microbiology. So how does the book help you in that? Is that first and foremost, in the general microbiology section, there is a chapter on basic concepts of medical parasitology, because the parasitology per se has been disjointedly shifted to other syndromes. So it was a need of the hour to familiarize our students with the general parasitology, its nomenclature, its definitions. What are the various relationships between host and parasite, a symbiotic or parasitism, and then the classification of these. What is helminths, what is protozoa, what is the basic conceptual difference between them in the structure, characteristics, lifestyles, and their mode of transmissions, and what was the concept of a parasite being infected. So the chapter ends with laboratory diagnosis as a overall arching view of parasitic diseases and immunity. So when we we simplified this overview and we simplified the contents, we have also given a little bit of consideration onto what are the various ways by which these parasites enter the body, and this also gives them a clue as to where they are going to find these parasites. For example, if the ingestion was from the mouth with the fecal-oral route, then they would find it in GIT. If they were vector-borne, they would find it at different places. So similarly, we went on with the various routes, with the various concepts of parasitology. And another complaint that has always been there in parasitology books is too much of stress is laid on the animal figures and the figures of the worms itself. So what we've done this time is that we have kept very, very simplified diagrams of the worms just in the basic introduction. We've created a simplified figure of the, say this is an example of the nematodes, and we've also created a very simple life cycles. So here in this basic chapter, you find a schematic representation of the life cycle of the whole of nematodes. Similarly, you will find of the whole cestodes some basic points about their structure, and then about what is the basic, the basic framework around which the individual life cycles, which are explained later on, gets built. So that the child has some idea when they are reading this basic chapter that yes, this is how a cestode or a trematode or a nematode passes its life cycle. Some may require 2 hosts, 3 hosts, the types of hosts, paratenic host, all that is explained in this chapter. And then there is a little bit of part on the immunity in parasitic diseases. Now, when we talk of the immunity in parasitic diseases, very often the students get confused as to what to write, where to write, and the immunological section doesn't give that much of a detail to them. So here the material is just for them to know what are the basic fundamentals of immunology which are there. And since they already have some knowledge of immunity and what is an antibody and what is IgM and what is a T cell from their biochemistry and physiology, this is not going to have a, give a too much of heavy weight on their conceptualization of immunology in parasitic diseases. And these are extremely simplified, just enough for the student to write their short note. Another point that you will notice here is that the book has gone from a paraphrasing to a bullet shaped structure, which gels very well with the young students who actually feel that there is an information which is very easily, reproducible when they come to their exams or their viva. This then ends with the laboratory diagnosis, where an overview of the laboratory diagnosis is given as to what are the various samples to be collected, how do you collect them, what is an NIH swab, how do you make a peripheral blood smear, what is a thick smear, what is a thin smear, what are the various molecular diagnostic tools available. So all that gets covered in the laboratory diagnosis part. And then we have the syndromic approach, like Dr. Reba has already taken you through, so I'll not take more time. And for example, this is the blood and CVS chapter where we're talking about the blood-borne parasitic infections of the bloodstream. So the whole syndrome flows from the basic considerations, diagnostic aspects, and then goes on to bacterial causes, viral causes, parasitic causes. And in parasites, the first and foremost becomes the vector-borne infections, which are blood-borne infections like Plasmodium, Leishmania, Trypanosoma, Filariasis, and all that gets covered here. And again, as I said, the life cycle per se have got a text as well as simplified illustrations for the students to get the portions very, very clear in their mind as to what moves to where. Earlier, the life cycles were very complicated, and in most of the parasitology books, there are multiple ways in which these life cycles are represented. Here, one look at the diagram itself, a child is able to describe the life cycle very well. Similarly, we have, say, Trypanosoma, very, very simplified life diagram. Then similarly, if we come to the chapter on GIT, it is parasites causing the infections of the gastrointestinal tract, where we are talking about how does the egg look like, how does the infection occurs, the various moltings that take place. And in the beginning, there is, every time a syndromic causes section starts, it gives you a list of the parasites that it's going to cover. So every time this chapter comes, it has got its change, and it changes itself to all the various things. These are the simplified diagrams that you can see of hookworms. And now in, say, for lung infection, the parasitic infections of the lungs, this Paragominus westermanni has been given a special consideration with very simple figures. And then, for example, central nervous system. Now, central nervous system and skin and soft tissue infections was a little complicated when it came to parasitology, because a lot of infections at some point of time do pass through these symptoms and cause lesions. For example, there were considerations that sometimes, there are very few parasites which per se cause CNS infections, like the free-living amoebae or toxoplasma, but there are other multiple organs also involved. So we kind of stuck to the fact that what is the majority of the crux of infections which are there by that organism, most commonly what are caused, and what are the most important ones. We stick to that, and then we have kind of categorized these organisms. But still, every chapter has got this list, that the parasites which cause CNS infections and what are their spectrums, and where all can you see these worms. They can be brain cysts sometimes. For example, Echinococcus granulosus, majority of it gets covered in the hepatobiliary portion. But we have mentioned here that there is a possibility of having a cerebral hydatid cyst. This also helps the students in its MCQ preparation. Oh, I missed that. So the other is parasites which cause skin and subcutaneous infections. And again, we followed a color scheme. And as you can see here, again, a lot of infections which can cause cutaneous lava migrans or lava currents. Now, all these, they might have been covered somewhere else also, but we've removed the redundancy and we've only mentioned here as to what all can you see. For example, Leishmania donovani or Kala Azar is actually covered in the blood chapter, but here we've mentioned that it can also cause these infections which are associated with skin and subcutaneous infections. So that's all about the parasitology integration that I feel. Thank you so much for patient listening. There are a few questions in this, and we'll address them.
Thank you so much, Dr. Saxena, for that very succinct summary of what we can expect from the integrated parasitology. May I request you to stop sharing your screen, please, so that we can, move on to the next interesting part of this webinar, which is what we have all been waiting for. I'm sure faculty also. The question and answers, a discussion perhaps between you and Dr. Reba, addressing the often asked questions, which we can see even in the Q&A box right now, which will again help faculty to understand how best they can use this book and what they can expect from this book. So I just hand over to both of you. Please go ahead.
Yeah, thank you, Dr. Sudha. Now that Dr. Sonal has just given an update on the parasitology, may I ask you, Dr. Sonal, what are the important aspects of parasitology that have been addressed in this book?
Yes, ma'am. Ma'am, all the aspects of parasitology have been integrated. It's been my conscious effort not to leave out anything. The only thing that have found just a mention somewhere and will not be described in details are those parasites which do not cause human infections very commonly. So those have been mentioned. For example, some parasites, tapeworms for dogs and others, which are those which are very, very uncommon in India. Those have been shortened so that we get more time to discuss and to see, because you see, since the duration has reduced, we had to cut down on those aspects. But the other aspects, especially those which are vector-borne and those are of importance in our country, they have been given very good amount of coverage in the book, and a very nice layout in terms of life cycles and other things. We've not done any issue with that.
Okay, thank you. And how have you actually divided the parasitology into clinical microbiology? How have you integrated it?
Ma'am, actually, the thing is that they have been divided as per the clinical syndromes, which when I initially started the work, I thought it's going to be a very, very difficult task to fracture out freshwater amoebae from Antamoeba histolytica, which we have been studying together for many number of years. So, but at the end of it, I felt that this, this block probably exists in our mind because we've been reading microbiology and parasitology that way. The student who comes into microbiology is going to read microbiology for once. So he needs that, as per CBME, his competency is to know about the parasites which cause CNS infections, which cause GIT infections. So then the whole concept had to be changed from the classification part onto the syndromic part. So all that was forgotten and the learning was given away. And I thought of myself being an undergraduate student who's come to microbiology and would want to read everything about CVS and blood infections at one place. Not go hunting around or picking another book for malaria or for Kala Azar and opening one chapter and then flipping 10 pages and going to another chapter. So that was the main idea behind this. And when there were certain things which even I got confused at times, and I took your help also and others people, that we, sometimes it is, the fact is so ingrained in our thought that it becomes very difficult to fracture out one particular parasite somewhere else. This happened with trypanosoma, which had to be split into 2 different chapters, because normally we read trypanosoma as being a very uncommon infection in India, and that was a challenge. So that then we worked around, and when we saw the final layout, I think both of us were very, very happy with the final layout.
Yeah, I must say that parasitology, like of course all the other topics too, was a real challenge in terms of splitting them up. Okay, thank you, Dr. Sonal. And I think you have addressed most of the points what has come up in our minds. like you have also addressed the fact that we have removed the redundant parts, which is very, very essential. And also you have highlighted on the importance of parasitology as an integral part of infectious diseases, because all along, as we see, every textbook of microbiology would have bacteriology, virology, mycology, and period. So now parasitology has also come into this group. So we are all in it together.
Yes. Yes, ma'am. And there are a few comments in the chat box, which I would like to ask you a few questions. And also most of the questions that I had in my mind and were given to me earlier, you've already answered in your presentation. But one of the main things, you know, like you said, in terms of clinical microbiology, do you feel that this flow of these chapters in this book, how has it got aligned to the new competency-based medical education? Because somewhere in the chat box also, I see a question that what part of mycology is included? So, ma'am, I would like to, you know, ask you this, that how have we've integrated everything, but how would you like to put up this? How has this flow got integrated with CBN?
Yes. Like as I have already mentioned that when we took up the syndromes, the thought that came to our mind is, how do we align these syndromes? You know, like go by what the CBME has put up in the NMC has put up in their chart. Like they have said gastrointestinal, they put CVS infections, then moved on to gastrointestinal, and then moved on to. So when we were thinking, we thought, you know, there is no continuity. Like, for example, if you take bloodstream infections and then move on to gastrointestinal, the organisms are completely, you know, disjointed. So we decided that, okay, let's put it in such a way that there is some kind of a flow of the organisms as well as the systems. So CVS being over encompassing the whole body, we thought we'll address that first and then move on next to the respiratory. Why this was done was that from bloodstream, we move on to respiratory and then to CNS. So organisms which cause respiratory tract infections like pneumococcus, Haemophilus, etc., they are part of the upper respiratory tract flora and they cause respiratory infections. At the same time, they also cause CNS infections like pyogenic meningitis. So in deciding to align these chapters, we said, okay, we just thought that after respiratory, we would put in CNS because they would have just read about pneumococcus, Haemophilus. So when they do CNS, it will be easy for them to recapitulate and say, oh yes, this is you know, colonized here and then enters this way and goes into the CNS. So that is the reason why we kind of aligned it. And so then from the respiratory, we went into CNS, and then we were moved on to the gastrointestinal, then genitourinary, and then finally we have taken up the skin and soft tissue, which again includes a large number of organisms, which by the time they come to skin and soft tissue infections, they have already read about these organisms in the various other sections. Now coming to mycology, again, fungal infections are very, you know, we know that fungal infections may, in a major way, come only in the skin and soft tissue, where the superficial and subcutaneous fungal infections have been incorporated in that. And the deep and systemic infections have been incorporated, some in bloodstream, others in the opportunistic infections. As opportunistic infections, they have been incorporated. And the Aspergillus and you know, histoplasma, some of them are have also found mention in the respiratory tract in terms of you know, allergic bronchopulmonary aspergillosis. So that is how the fungal infections, fungal agents have been incorporated into the systemic approach of infections.
Yes, ma'am. Thank you so much. And the other is that how has the book addressed the MCQ needs of the students? Because as per NMC now, it's going to be a combination of short answer, MCQ, and a long question. So up to 20% syllabus, it recommends that as part of assessment, please at least 20% in summative assessment should be MCQ. So,
yeah. So yeah, thanks, Sonal. The thing is, in the first two chapters, that is the overview, general microbiology and immunology, we have incorporated just a few MCQs as examples. And in the syndromic approaches, we have not included any MCQ, mainly because we wanted to keep the book a little, concise, so that it's easy for the student to, handle. Otherwise, it was becoming very bulky. So we wanted to contain that. However, there are a huge MCQs which have been given by various faculty, which have been collated from various faculty sources, and that is available online in the app. So so if anyone wants access to the MCQs, then that is available there, and a few, of course, are there in the textbook as such. So it is available. The MCQs are available. You can download them.
Okay. The other question which is there in the this thing is that there is something about the question pertains to interdepartmental integration aspect as per CBME, and how you see that coming and how do you take it forward. Further, if how you are taking the SGDs, given a very limited availability of faculty, especially for private funded institutions. So maybe I can say a few words on this, ma'am, because
go ahead.
I have discussed it with ma'am. There are a few advantages I feel of integration which is available to microbiology, because the students are already familiar. Say for immunology, the students are already familiar with immunology. And what happens is that once they are familiar with immunology, a lot of topics overlap with pathology as well. So what we've done at Maulana Azad is there are many topics: immunohematology, transplant immunity. All these topics are actually, we have horizontally aligned them with pathology in such a manner that they take the lecture so that we don't repeat the lecture. We discussed with them right in the beginning of last year that, okay, these are the lectures you are taking anyway. So, but to have a microbiological aspect, we discuss these in our small group discussions which are there with us. And that has helped us a lot because the number of hours are reduced. So we get this thing to cover. 2 topics they gave us, say for example, tuberculosis, for us to cover. They have done away with their topic of laboratory diagnosis of tuberculosis. And we have also included some histopathological aspects of tuberculosis, and they discuss it with their small group discussions when they show them the slides and all. So that's how I think if you can, work around with your departments. For example, last year we did skin and took help from skin department, and we although it was an online lecture only, but we included their lectures when we were discussing skin and soft tissue infections, because we felt the various fungal infections and their clinical presentation, how to collect the sample, the dermatologist would be able to describe it better. So we included them. This year we plan to include the ART center at our college and HIV medicine center that we have as part of the HIV portion. And we've aligned it with pathology in such a manner that, and with medicine, that when medicine is teaching the ART, we have already taught them the basic fundamentals of HIV, and pathology is also covered a lot of things. So that way it gets aligned, and that takes care of the duration that we've lost, and also the faculty shortage or SGD. And the departments which have postgraduates and senior residents and tutors and demonstrators, maybe those institutes can take a little bit of help from them, because we anyway give them teaching experiences and we are supposed to involve them in all the teaching. So the small group is an area where they can begin with, and we can involve them, and it's going to help them, because CBME is new for everybody, even for them. The way they learned microbiology 3 years, 4 years, 5 years back, or even now, is very different from there. And somebody has asked that, is the book going to help the postgraduates? Ma'am, that I feel that it's going to help the postgraduates, because basics never go out of fashion. So to build up your basics in a syndromic manner, the book is going to help you. But usually the PGs are in the habit of reading parasitology, mycology, so they might feel that, okay, this doesn't serve the purpose. But I think slowly we have to believe, and we have to become clinical microbiologists, and we have to move out of the labs. So the book is actually preparing you for that. Yes, ma'am.
Sorry. Yeah, the very valuable point that Dr. Sonal has brought in is that the utility, the use of this book by postgraduates. I would suggest that this should be the foundation book, besides their text, whatever they are reading in terms of specific subject, they should also go through this Anant Narayan's 12th edition, mainly because they are going to be tomorrow's teachers, and CBME is not going to go away. So if they align themselves or if they learn this, then it is definitely going to be an added advantage for them. So postgraduates too should be able to, benefit from this book. Second thing that Dr. Sonal has brought out was the integration. What we had done in Pondicherry Institute of Medical Sciences is that we actually collaborated with or had sat down together with these departments like medicine and pathology, and worked out the timetable in such a way that whatever topics they were taking, we would also align them. And plus certain topics, the faculty from medicine or the faculty from pathology would integrate with the faculty from microbiology, and then the teaching would be an integrated approach. The small group discussion, one of the important things that one has to keep in mind is that there should be uniformity across the groups in what the faculty are teaching. So what I would suggest is that before a small group teaching session starts, the faculty who are going to take should sit down together and decide or make points as to what are the points that they are going to discuss, so that there is uniformity. Otherwise, the students, they will say, oh, this ma'am taught me this. Didn't your ma'am tell you that? So it's that kind of a comparison would come, and then the students would be all confused. So my request would be that before every small group discussion, the faculty should sit together, which the head of the department's onus is to ensure that the faculty sit together, decide on what they are going to teach and how they are going to teach, and there should be an uniformity.
Ma'am, I would like to give you one little thing here, that with CBME has come the need to make learning objectives. And for every competency, we made learning objectives. So last year when we started CBME implementation, we circulated those CBMEs to all the learning objectives to all faculty and to all residents at that particular time. And now when we were starting the BDS batch 2 months after that, one of the faculty came to me and asked, ma'am, where are the SLOs for BDS curriculum? Because now it became such an ingrained concept in my department that before preparing a lecture, the faculty goes through those learning objectives, and the residents before SGD also have an idea that this is what they are supposed to cover, going through their SLOs. So preparing your departmental SLOs is an excellent way of doing it. And we had divided the competencies amongst ourselves and prepared those SLOs. That becomes a document, and that helps you in aligning what you're saying, that everybody talks the same page to the same extent, because we should know where to stop. And
yes, sorry, I'm always interrupting you, sorry.
I was about to say that, ma'am, if you want to add something.
Yeah, and to address this part, actually Anant Narayan's 12th edition, if you see the syndromic approach, at the beginning of every syndrome, there are learning objectives. So that will help you to, set your goal, and the faculty can sit down and discuss these learning objectives and how to address them. So that will help you. The Anant Narayan Panikkar book has this advantage of learning objectives.
And I can see Dr. Varsha Gupta's comment here that medicine PGs also read microbiology books. Yes, definitely, ma'am. And this is going to help them also. Yes, because it's more clinical oriented. And for them, there are no divisions. They don't, like to put things in, like us, in boxes of, like my guide used to say, we talk in silos. So I think for them, it's going to be very, very, good about it. And someone is asking that is there any detail on SGD and SDL? Now, you can take any topic to SDL. Self-directed learning, you can give any topic. My suggestion would be to include something which students don't normally spend that much of time upon, but it is very important to them in the applied aspect. Like maybe the latest guidelines of biomedical waste, which keep changing. latest guidelines of infection control. Ma'am, any take on that?
Yes, and also, since it is very case oriented or case based, a particular case can be taken up and then give the case to the students and ask them to go read up and have a self-directed learning on that particular case, like a tuberculosis, a case of tuberculosis. So these topics also can be picked up and given as SDLs. And I would also take up on what Dr. Sonal said, was that the medicine, community medicine, pulmonary medicine. In fact, the university question papers, if you look at some of these question papers, they are all microbiology questions. Like community medicine has a huge this thing on leprosy or tuberculosis, and pulmonary medicine, what I saw in Pondicherry University a couple of years ago was, almost 30% of the questions were from microbiology. So yes, it is definitely, this book is going to help even the clinical students.
There is one more question, ma'am, for you. Wonder if the book addresses certain aspects or common characteristics like set of Enterobacteriaceae, arboviruses, classification of Streptococcus, Vibrio, etc.
Yes, very good question. That this has been answered. This has been addressed in the overview chapter where applicable, and in the syndromic approach, like for example, Salmonella classification. The arboviral classification, I think, is has been addressed in the virology overview, and Streptococcus also has been addressed in the Streptococcus, where the major part of the Streptococcus is being discussed, and also the Salmonella. So classification, the original classifications have not been abandoned. They have been incorporated into this in the book.
Yes,
you will get the classification.
There is a chapter on systematic bacteriology, which covers these basic aspects, which I found was the most useful part when it comes to bacteriology, because we are not moving away from our initial classifications, but keeping them in the mind somewhere. And Dr. Manish has asked that how small is an Sgd supposed to be? Technically, as per FEMA guidelines, it's only supposed to be 10 students.
10.
But I don't think we are following that, and we go 4 and 5 times often of that, depending on the number of faculty that is available to us. And some colleges have addressed this in such a manner that they divide the students into 3, 1/3, pharma, path, and micro, and then the Sgd becomes easier, because then you have only, say, 60 students a day, which you can divide into 4 or 5 depending on the faculty. But then, like a school, it will become an everyday, will become a teaching day. And with a working department, it sometimes becomes very difficult. I agree. So I don't think anywhere we are following the guideline of 10 as the number of students.
Yeah, I would like to address this concern of most of the senior or most of the microbiology teachers, in the fact that don't think that this book has completely thrown out all the basic microbiology that what we are comfortable with. Let me assure you, the first couple of chapters that you read will have all the basic information, which includes the growth, nutrition of bacteria, the important media that is required for the bacteria to grow, the biochemical reactions. All these important aspects are still retained, but have been fine-tuned to suit what is actually necessary.
Yes, ma'am. And Dr. Pramod Goyal has asked you another question, that there must be a repetition of organisms, as bloodstream organisms can cause respiratory infections too. So I think, ma'am, you can talk about the redundancy here that we try to.
Yeah, exactly. So what we have done, again, there is repetition. So let's take, for example, Staphylococcus. Staphylococcus comes as a bloodstream infection, major. So we have addressed the major part of it in bloodstream infection, but again, it causes skin and soft tissue infections. So at that point of time, we have not gone into the details, but however, we have not thrown out Staphylococcus from skin and soft tissue. It has been mentioned there, but in very brief. So, and there also we have made a reference saying that The details are available in chapter. For the details, you can read chapter 20 or whichever chapter the details of that organism comes in. So that reference is also there, whereas the major chunk of the organism is discussed wherever it is most relevant.
Yes.
But repetitions are bound to occur. Repetitions are bound to occur, but when the repetition comes, it's just a mention of the organism. It's not going into the details or repeating the whole thing, what has been provided in the initial chapter.
Same thing is happening with parasitology also.
Parasitology.
It just gets mentioned there.
Yes.
May I just step in, ma'am, because there is a lot of questions and interest about perhaps PPTs available for faculty and students. So could you, and clinical cases, because you are restricted by page extent to a certain extent when you're dealing with a book. So what are the provisions that have been made for extra clinical cases and PPTs available, MCQs?
Yeah. So MCQs, as I've already mentioned, a whole booklet of MCQs is available online. On the online in the app, and also the AdCom manual, little booklet. In addition to that, we have PowerPoints which have been made based on the 12th edition of Anantanaran and Panikkar. Each chapter has got a PowerPoint. So that whole lot of PowerPoint is also available for the teachers to download and use them in their teaching classes. And finally, the
clinical cases.
Cases. There is again another whole lot of clinical cases which is available online. So all these addendums to the book, the annexes to the book, are all available online. We just didn't want to incorporate all of them, the MCQs, the AdCom, etc., into the book, mainly because we didn't want to have a very bulky book. This is a very easy to handle a book, which is around 600 odd pages.
Ma'am, can I add here? Another thing is that when you are working on the PPTs, there are many chapters which will have multiple PPTs, because the syndromic approach chapters were very huge, and we had to make multiple PPTs because maybe there will be one lecture on fungal infections, one lecture on parasitic infections of, say, skin, if we are talking about. So we've made multiple PPTs to address that. And when I was collating these MCQs, a lot of MCQs we have recreated using a clinical scenario. So it's a blend of clinical scenario MCQs as well as the traditional MCQs, which we've been used to having. And instead of providing, most of the students gave this feedback that they often lose that tiny booklet which comes with Anandnaran. So we all felt that it's a generation, what Z generation. So they should get an app where they can solve these MCQs. And because a few of you have raised this concern that since we are required to ask them the MCQs, we should also get a guide as to how to make them. So that we try to give a mix of both the clinical oriented MCQs as well as the traditional basic fundamental MCQ.
All right, ma'am, we have gone beyond our time. It's been so interesting, and I think we can stay here till 9 at night to continue listening to the discussions and all the features that Anantnaran has packed. Yes, ma'am.
Just to conclude, one additional feature of this book is that at the end of each chapter, we have the key points and some self-assessment questions. So if when the undergraduate student is reading the book, they can use these guidelines and at the same time use the short answer questions as a self-assessment.
Excellent, thank you. And having worked with you on the book, this is something I wanted to ask as the final question. What was the one focus point you held in your mind throughout editing this book, ma'am? Dr. Saxena and Dr. Reba, what was that driving point when you were dealing with this edition? What was guiding you and what was telling you this is it and no more? Because faculty is going to have a wish list which is a mile long. Some will want more of this, less of that. What was your guiding feature?
The point which drove me to was I put myself in this place of a student, of a student who comes in straight from microbiology, and who's not aware of anything, how do I incorporate what is the basic minimum essential knowledge, which is going to help the student once he passes out from microbiology to be able to tackle the infections that he's going to come across.
Dr. Saxena, any such
I think
thoughts?
I echo ma'am's comments actually, and I actually felt that my daughter had just given her exams, and after that I felt if she was a student now of microbiology, although she had passed microbiology 2 years back, so I felt that if she was a student now, where would she get stuck? What are in the new curriculum, how would she get stuck? So that was one. And the other thing was that as a medical college teacher, when I was very deeply involved in preparing the curriculum at my college and uploading on the website last year. So at that point, a lot of things drove into my mind that, okay, when we are aligning these competencies and when we are distributing these learning objectives and to various teachers, the biggest issue was that it was very difficult for teachers to initially grab the idea that today I teach malaria and tomorrow I teach a virus or dengue. And one of the faculty came to me and said that, are we teaching dengue in the same session? Because it is, after all, a blood infection. So this was another thing that I felt that we are ourselves confused, as I said, in silos. So we needed something to, like a thread along a string of pearls to tie everything together. And I just hope that this book works to tie all these pearls together.
So yes, it's very evident that there's plenty to look forward to, by faculty and students from the 12th edition of Anantnarayan Panika. And we certainly hope that your effort and your thought process and everything is conveyed to faculty through this book. So I have to really, sign off here. Thank you very much. And I will hand over now to Malini, my colleague, who will take us through a few important points and then the vote is done. Malini, over to you.
Very good evening to our respected panelists, valued attendees, and my dear colleagues. I'm Malini Gopalakrishnan, and I'm privileged to conclude today's session. First off, the 12th edition of Anantnarayan Panika is available on the Orient Black Swan and Universities Press websites. We will soon be sharing with you a slide with QR codes that can be scanned and will redirect you to the respective pages. The book will also be available on Amazon next week. Now, I would like to thank everybody who made this event possible. On behalf of Universities Press, I would like to extend my gratitude to our esteemed panelists, Dr. Reba Kanungo and Dr. Sonal Saxena, not only for putting so much thought into today's discussion, but also for working tirelessly on this book to ensure that it would meet the needs of undergraduate medical students. Thank you, panelists. I would also like to acknowledge and thank the members of the audience who made time to attend today's session. I really sincerely hope that you found this webinar informative and interesting. Last but not least, this event would not have been possible without the support of the management team and my colleagues at Universities Press and Orient Black Swan. A big thank you to you all. Once again, a very good evening. Thank you. I'd like to draw everybody's attention to the slide on the screen. We have the QR codes for the the pages to purchase this book on the university's Press and Odeon Black Swan websites. Thank you.